Throughout the 20th century, diseases pillaged nations, killing millions of people. Doctors were ill-equipped and unprepared to fight off the biomedical barriers. However, in the 1950s, everything changed. Henrietta Lacks revolutionized the medical field and became the first person in history to live forever.
HeLa cells are a line of regenerating cancer cells used for medical research. Cell lines come from people and therefore allow medical professionals to study the effects of products on humans without actually testing on human beings. Today, they are an invaluable tool in medical development. Although surrounded by controversy, the creation of HeLa cells was the most important medical development in the 20th century because they extended accessibility to accurate methods of research, broke barriers in medical knowledge and treatments, and improved and protected patients' rights.
The 20th century was a time of innovation. The United States had now gone through the Industrial Revolution and was quickly entering the modern era. Dangerous outbreaks of diseases took thousands of lives and also interfered with daily life and productivity. Doctors and scientists were determined to create cures and new medicines. Thus, the 20th century had some of the greatest advancements in the medical fields. Yet scientists faced a major obstacle when it came to testing new drugs for effectiveness and safety. They could either test on animals, which was often inaccurate, or they could test directly on humans, which was dangerous. Scientists needed to be able to test on human cells without harming anyone directly. However, at this time, cells cultured for laboratory studies survived only for a few days at most, which wasn't long enough to perform a variety of different tests on the same sample. Henrietta Lacks was the solution.
Henrietta Lacks was a poor African-American woman. At age 31, she was living in Maryland with her husband Day and her 4 children when she started to experience sharp pains in her womb. She traveled to the only hospital in the area that treated African-Americans, Johns Hopkins, where she was treated by Dr. Howard Jones. He diagnosed her with a severe case of cervical cancer, a death sentence. Henrietta's condition quickly deteriorated as her tumor continued to grow at an uncontrollable speed. During one of her visits, Dr. Jones took a sample from her tumor and sent it to the research lab of Dr. Otto Guy. While Henrietta did give consent to having samples taken, she was never aware that they were being sent to research labs. Later in August, Henrietta was admitted into the hospital as a hospice patient. Henrietta was in bad condition, her body charred black from her radium treatments and weak as the cancer had spread throughout her entire body. Then on October 4, 1951, Henrietta passed away. Immediately afterwards, doctors performed an autopsy, much to the dismay of her husband Day Lacks, and took even more samples, sending them to the lab of Dr. Otto Guy.
Otto Guy was a leading cell biologist at Johns Hopkins whose life mission was to create the first immortal cell line. During the time that Henrietta was being treated, nearly every cancer patient at Johns Hopkins had their tissue samples sent to Dr. Guy's lab. Guy and his wife Margaret operated the lab with the help of assistants who spent every day doing tedious work, sterilizing, cutting, and observing the new cells that came in. It was here that Henrietta Lacks became HeLa, as young technician Mary Kubaik labeled her test tube of cells. Kubaik was the same technician who would exclaim, "My God, they're growing like crabgrass," when she discovered the rate at which Henrietta's cells produce. When she shared her discovery with Guy, he nurtured HeLa, perfecting the line and culture it was kept in until he was confident that HeLa was truly immortal. He then excitedly advertised it, going on TV and announcing his achievement. He then sent HeLa around the world, giving it to any scientist who asked, with the goal of wanting to improve and benefit science. Through these efforts, HeLa cells were quickly becoming a staple in labs worldwide.
Otto Guy's HeLa cells were not normal. Healthy cells experience programmed cell death, or PCD, in which repeated cell divisions cause the DNA to become unstable and eventually unable to replicate, resulting in the death of the cells. However, cancer cells do not experience PCD. Just as how cancer developed in Henrietta Lacks' body, her cancer cells in the lab started growing nonstop. No one truly knows why Henrietta Lacks' cells multiplied rapidly, but there are theories that her other conditions such as HPV and syphilis may have changed her cells. When researchers looked at HeLa cells, they had 76 to 80 mutated chromosomes, as opposed to normal humans' 46.
The greatest short-term impact of HeLa cells was the development of the polio vaccine in the midst of the polio epidemic of the 1950s. Soon after the development of HeLa, the Polio March of Dimes Foundation reached out to Guy and took him up on his offer of using HeLa for free. At this point, Jonas Salk had developed the polio vaccine, but needed to conduct testing to ensure its safety before releasing it. Soon afterwards, the vaccine was proven to work and was distributed across the country, saving millions of lives and eradicating the disease in less than 20 years. This major success put HeLa on the map and made more scientists aware of its power and value. Suddenly, scientists around the world were all buying vials of HeLa, commercialized by Tuskegee, and it was becoming a staple in labs everywhere. This extended accessibility to accurate methods of research and paved the way for new advances and breakthroughs in the long-term future.
In the long term, HeLa broke barriers in medical knowledge and treatments. Hundreds of medicines, antibiotics, and vaccines were developed due to HeLa. The field of virology became an area of interest to many medical researchers because of HeLa. HeLa cells also brought attention to cloning and the potential it held for future medical advancements. A little over a decade of its development, HeLa went into space to study relationships between space and the human body. In the 60s, it was also used to discover new knowledge on treatments of blood disorders. In the 1970s, it shed light on the causes of salmonella infections, while in the 80s, it made significant contributions in cancer, HIV, and tuberculosis research. In more recent times, single-cell imaging, telomere research, and developments in thalidomide are notable impacts of HeLa. Some key researchers in these studies were even awarded the Nobel Prize.
HeLa not only led to medical advances, but also improved and protected the rights of patients undergoing treatments. The Common Rule was a rule of ethics for human biomedical research, passed in 1981. It emphasized the requirement of consent and anonymity. Later, in 1996, the Health Insurance Portability and Accountability Act, also known as HIPAA, was passed by Congress. It stated that a doctor cannot release a patient's name and medical records without their consent, like Johns Hopkins had done to Henrietta. Finally, the fields of medical ethics and bioethics are now options for college majors and profitable careers.
However, not everyone was and is on board with HeLa. Although HeLa cells itself cannot be patented, there are over 17,000 other patents that make money involving HeLa cells. Lawrence Lax, Henrietta's son, has demanded compensation from Johns Hopkins for the unauthorized usage of his mother's cells that have aided in a multitude of significant medical advances.
Every generation since Henrietta has been sucked into this research without their consent, and each generation, in some ways, it's a bigger violation.
Several efforts have been made, and some family members support HeLa, yet Lawrence Lax still disagrees with the portrayal of his family and how they were treated. However, the other side of the argument is that it was inferred that Henrietta gave consent for research. Henrietta had agreed on the extraction of her cells but had not been asked whether it could be used for research. In the 1950s, there was no law that required permission to use a patient's cells for research. It had always been inferred. The doctors had indeed been cautious of her privacy.
He always called them Helen Lane, even at home. I think to preserve her identity.
Today, HeLa cells have become popular in the media, especially due to Rebecca Skloot's book, The Immortal Life of Henrietta Lacks. The recognition of the impact of HeLa cells has grown significantly. Documentaries, interviews, books, and articles on the topic of HeLa cells can now be found everywhere. The HBO movie, The Immortal Life of Henrietta Lacks in 2017 even stars major Hollywood names such as Oprah Winfrey and Rose Byrne. This popularity in the media brought more overall public awareness to the story of Henrietta Lacks and HeLa cells.
HeLa cells revolutionized the medical field by creating an immortal supply of human cells available for experimentation. HeLa cells were also able to be mass-produced and distributed to the world's brightest minds, creating more access to accurate methods of research. The controversy surrounding the treatment of Henrietta Lacks improved and protected patients' rights through new legislation in the latter half of the 20th century and the early 21st century. HeLa cells paved the way for new treatments and cures and have had a clear, lasting impact still seen today. This cell line is perhaps one of the most important medical developments of the mid-1900s, yet despite all of its contributions, HeLa has been lost in history.